Canadian patients waited longer than ever this year for medical treatment. This, according to the findings of a study just released today. It's by the Fraser Institute. The study reports a median wait time of, get this, 20 weeks. That's the longest recorded, and more than twice the 9.5 weeks Canadians waited in 1993. Let's wade in on this with our guest, Heather Shantora. She's the CEO of InnoCare Canada. It's a global healthcare and technology company which partners patients with clinics. Heather, I use the word patience. Sounds like Canadians need to exercise a lot of patience when they go see the doctor today. What the hell's going on?
You're right. It's shocking how much it's increasing in BC in particular. Every single year they're experiencing more of a wait. The weeks you gave were actually the national median. BC is actually 25.2 weeks. It's pretty shocking, especially when there's other alternatives available.
And are we talking GPs, emergency care, all across the healthcare spectrum here?
They actually researched six different disciplines, but GPs in particular, across Canada, 1/3 of patients said it takes 6 days or more just to see their GP. And then for a specialist, it's actually 41% of Canadians said that they had to wait 2 months or more. So, I don't know if people generally know this, but half of patients who end up in a GP's office actually have a musculoskeletal injury, like a sprain or a muscle ache or something like that. And that can actually be dealt with outside the GP's office through physiotherapists, chiropractors, etc. And these are people who've already received a master's degree in clinical care, are held to a regulatory standard, and they could be easing the burden and helping get Canadians better faster. Except, the way the healthcare system's set up, it really funnels everything to the GP when that's actually not what's required anymore.
Well, I'll tell you something. I haven't had a GP since 2006. My doctor in Ottawa called it a career. And then I was moving in 2005, and I was moving to Toronto the following year. And so I couldn't get one there. Good luck with that. And I haven't gotten one here. So there are a lot of Canadians who don't even have a GP.
Yeah, I mean, and that's probably a whole other topic for a whole other research paper, right? Like it's especially when you think about the elderly and children, and our right to a nationalized healthcare system is exactly that, a right. But I do think that what we're not doing as a nation is a good job of publicizing the fact that there's actually a whole bunch of primary care clinicians. So what that means is you could actually go to a nurse practitioner. You can actually go to a physiotherapist with an ache or sprain, and you don't actually need to see the GP first. And in fact, because their scope of care is so specialized, they can actually get you better faster. And yet that's not how we communicate things when we get information from Health Canada or even the way we talk about it as a nation. We very much think of doctors first, when in fact we have an entire array of clinicians available to us. And I think it's just a lack of understanding that there's a whole force of primary healthcare clinicians out there ready to help, and yet everything's being funneled to the GP just because historically that's how Health Canada has communicated it. And
I want to get back to the study in a moment, but historically as well, we Canadians have had taken a lot of pride in our healthcare system, and certainly it's better than the system that's in place for our neighbors to the south. But I hear a lot of stories of people waiting hours at the hospital, hours at their GP, go to a day clinic, and you're waiting and waiting and waiting. They close them up because there aren't enough doctors. Do we sort of inflate how good our healthcare system is, in your opinion? Because we take pride in it, but sometimes it lets us down.
I'm a very proud Canadian, and that includes a lot of pride in our nationalized healthcare system. What I actually think where we've gone a little bit wrong is that we've actually increased the amount of paperwork required for physicians. Now, while that's good because it guards patient safety and it ensures quality standards, with these heightened regulatory requirements and privacy laws, the requirement in terms of their paperwork and charting has increased. So actually, doctors today are actually giving less direct patient care and more time is spent on indirect patient care, such as charts, making phone calls, filling out, paperwork for ICBC, for MSP, et cetera. So I actually think what we need to do as a country is allow doctors to use back office solutions. So, for example, one thing that my company does is we have electronic charts. They're very efficient and intuitive. If that saves a doctor an hour a day, that's 3 more patients that they could fit in a day. If every doctor did that, well, our wait times would decrease dramatically, wouldn't they? So I actually think it's about putting technology into the healthcare system to allow our doctors to be more efficient and therefore treat more Canadians. Yeah,
that has been a buzz topic. I want to correct myself. I think I may have said daycare when I was trying to say walk-in clinics. I don't know, my brain is. A lot of people are concerned, though, with the use of the electronic venue to send their files. They're worried about privacy issues. Is that a concern for you?
We are so closely governed. And in terms of the privacy law, our data, for example, cannot leave Canada. So it's held in servers in Canada. Those servers are backed up, encrypted, tokenized. We go above and beyond in the Canadian IT world to make sure that everything's protected because our legislation is stronger than other countries, and that is something to be proud of. But the PETA and the other privacy laws by province do require a huge investment in privacy. So as long as we're adhering to that, then there really isn't much to be concerned about.
Okay. Our guest is Heather Shantora. She's the CEO of InnoCare Canada. We'll take a quick break. When we come back, I'd like to hear your horror stories, folks. 250-386-1161, star 1070, or by email, talk@cfax1070.com. The doctor is in. There'll be no waiting. We'll continue our conversation in just a second, Heather. We'll start off about how BC, now for 4 years in a row, has seen an increase in the time that people are waiting in the waiting rooms. Can we do that?
Mm-hmm.
Okay, perfect. Among the provinces, Ontario recorded the shortest wait times last year, 15.5 weeks. New Brunswick, whoa, you got to wait a long time to see a doctor there. 38, almost 39 weeks on average to see a physician, a medical practitioner. BC, 4th year in a row now, there's been an increase in the wait times. The median sitting time is now 20.5 weeks. That's the longest ever measured in this province. This is according to a study that was released today by the Fraser Institute. Our guest is from InnoCare Canada. She is Heather Shantora. She's the CEO of InnoCare Canada, which gets patients and practitioners together. Speaking of that, Heather, how does one try to get together with their practitioners? Are there some sort of healthcare tips where you could sort of make better use of your time?
Absolutely. The challenge, though, with the Internet is that there's so much out there. I know that sites like ours, and there's plenty of them in Canada, are very content heavy so that you can find what it is you're looking for. I think the biggest thing is to make sure you're on a credible site. What I would advise is that if, for example, you had arthritis, going to something like the Arthritis Society site, and then from there being directed to trusted healthcare providers, I think that's the best way to go so that you make sure, first of all, that you're within a Canadian site, but you're also getting quality information from the associations that are deep in the details of those conditions, and then they can refer you to the correct type of care that you need with the correct clinician.
So you're doing your own triage via the Internet?
You know what? Canadians are doing it anyway. It's not even that we're encouraging it. I don't know if you knew this, but the most searched thing on the Internet now is health. And among health apps, millions are actually downloaded every single day. It's the number one downloaded and searched on app stores is health apps because people they're really doing their own research now.
Yeah, they're tired of waiting. Okay, have you got a horror story from the waiting room? 250-386-1161, star 1070, or by email. You can go talk@cfax1070.com. That's what Ron did. Ron says it would help if our Medicare was covered, if our Medicare covered chiropractor, osteopaths, etc. I think it does cover physio somewhat. And that's a good point that Ron makes. Heather, because you mentioned earlier, instead of going to see your GP for something, one half of patients who go to GPs could have gone to see another healthcare practitioner, such as a physiotherapist. What do you say to that when Ron says, well, yeah, but that's not covered?
He's right. So a lot of these things used to be covered, and as healthcare budgets swelled, they got delisted. So in BC, low-income families are covered by MSP, and they're entitled to physiotherapy, as an example, to use his example. In other provinces, that typically is the same case, but it depends how you're injured. If it's a work injury, you're going to go through WCB. You don't need a doctor's referral. You can go straight to physio-chiropractic massage, and it's actually covered by workers' compensation. However, in the case of ICBC, you actually do need a doctor's referral to get rehabilitation. Now, that does strike me as odd, and one of the things that the co-authors of this research study offers up is that, policymakers need to consider reforming outdated policies that are contributing to these long wait times in Canada. So if they do want to alleviate wait times, you're right, some of these services should be relisted into nationalized healthcare, but also why make a requirement to go to the doctor's office only to be referred somewhere else? Because that's just creating congestion in the system.
Yeah, I completely agree. How many times have we done this? TJ just told me a story off the air, very same story last summer. He knew what was wrong, and you have to go see the doctor first before you go see the specialist or the physio. It's crazy. Alex, you've been waiting for quite some time. Go ahead, Alex.
Hey, Mark, Heather, how you guys doing?
Good.
Hi.
So, 3 years ago, I fell off a bike, landed elbow first in the pavement. Completely shattered the elbow. Required surgery to put it all together because it was in multiple pieces. But get this. When it first happened, I went to the emergency room. They put me in this, after the x-rays and determined what it was, they put me in this half cardboard cast thing. Didn't even wrap around my arm. It was like a cup shape that just kind of held it in place, and sent me home for 3 days because the surgery kept getting pushed and pushed and pushed.
Oh, no.
Don't eat or drink anything because we might call you any time.
Oh, what a nightmare. So for 3 days you're on pins and needles waiting for the phone to ring, and you don't know whether you're allowed to eat and that sort of stuff.
Yeah, and my arm's just kind of, like I said,
killing you.
Cardboard.
What ended up happening?
Oh, they called me in 3 days later, and I had the surgery. It took 8 hours, and 5 screws and some other bits of steel to put it all together. But I'll tell you this, my elbow has healed quite nicely. I've got almost full range of motion. There's no strength problems with it. That was great. It was just the waiting for it.
Yeah, the waiting's tough. Mm-hmm. Appreciate the story, Alex. Thank you, sir. Be careful on that bike out there.
Oh, I haven't biked for a while now.
And wear your helmet if you do bike. Thanks, Alex. Heather, you hear a lot of stories like that?
Absolutely. Again, this is where I think technology could play a role. If you think about any other service you go to seek, so let's say you're booking a flight or you're booking anything, you can book ahead, you can book online, things are efficient. Why is it in the healthcare system we can't determine when we're going to treat you or, send you home for 3 days on pins and needles, not knowing if you're next? I think if we kind of got with the 21st century in the healthcare system and really adapted technology, we would be in a much better position to predict all of these things because scheduling would be automatic. You could actually predict the inputs to determine the schedules and predict the outputs. Like in any other industry, it is so organized and efficient now. It's remarkable, really, with the use of technology. And yet we haven't adopted that into healthcare either because the policymakers are slow to make those recommendations, or it's down to budget. They don't want to spend the budget. But in fact, it would make the system more efficient.
Listen, we got to go. I don't want to make you wait any longer. We got to fly for the newscast, but I appreciate your time. Yeah, that's what we do here. Heather Shantora, thank you very, very much for your time. Very much appreciated.
Thank you, Mark. Bye-bye.
Take care. Heather Shantora, CEO, InnoCare Canada.